endoscopy image. So now after the esophagus, we'll just move on to stomach. Of course, it has much more pathologies involved in the stomach. So we'll start off with the gastritis, then look at the infective conditions, and then move on to the neoplasms. All various kinds of gastritis that you encounter, erosive gastritis, either you see a tiny fleck of barium that's surrounded by the mound of edema, which gives rise to the radiolucent halo, and it's called as the target lesion. We keep getting a lot of target lesions. So basically you see something brighter in the center and a radiolucent halo around, or even an intersusception also, you have a sign called as the target sign. So either you see a small speck of barium, or you see a radiolucent or curvilinear barium and then a central halo. So that's a classic case of erosive gastritis. Antral gastritis, as the name suggests, you can see that there is significant thickening of the folds, but in the region of the antrum. So very classical. So in the region of the antrum, if you see thickening of the mucosal folds, so the gastric folds, it is antral gastritis. Granulomatous, we'll spend a minute here. Granulomatous is of course commonly seen because if you are in a GI setup, then you get to encounter a lot of inflammatory bowel disease, in which Crohn's is an important entity. So you have a classic sign here which helps you in differentiating the granulomatous gastritis from the other gastritis. It's called as the ram's horn. As we all know, the ram's horn, it's going to flare up as it goes superiorly. So you have a tubular narrowed antrum which is going to flare out into a normal gastric body and fundus. And usually the duodenal bulb and the proximal sweep are almost always involved in granulomatous gastritis. So that's a classic appearance. You can see that not only the duodenal bulb is also involved, and then the antrum, but in this case, of course, a portion of the body is also involved, and then the fundus, it's flaring out into the fundus. So if you can imagine the ram's horn, it's how it looks even on the barium. So corrosive gastritis, as we have looked at the esophagus, the similar one, it's caused by the ingestion of acid, and again, acute changes, you have thickened gastric folds, and which can give rise to atony and rigidity. In the chronic changes, you have a firm, thick, non-pliable wall, and sometimes